Hi, I'm Lori Handy. I'm the Associate Director of the Vaccine Education Center at CHOP and a pediatric infectious disease physician. Sure. So I think every fall we kind of go into it and say we're wondering how bad will RSV season be or a flu season, and will COVID kind of increase this year? We're also currently, unfortunately, looking at measles trends this year, which have really reached an all-time high in this country and don't really show signs of abating. So I think that we know that children are going to get sick from a variety of respiratory infections, and I think the few pitfalls that would be great to avoid is one, figuring out how to best ensure access, both for vaccines and for treatments. Because the worst thing is a family who says, "Gosh, I actually do really want to get vaccinated for flu this year," and calling up and finding out, the next availability is like December 4th at 10 a.m. And that really kind of makes that family less confident in the healthcare system, lose some trust, feel like I'm trying to do the right thing, help me do the right thing. The other piece is messaging around these vaccines and helping families realize we are not trying to eliminate respiratory infections with vaccines. We are trying to make them less bad. So we might vaccinate a child for flu and COVID and RSV, and they could get any one of those. But ideally, we are keeping them out of the emergency room, out of the hospital, out of the intensive care unit. And that's really the goal. And the better we can position families to understand that, I think the more kind of bought into that prevention they'll be. Sometimes I think we can use the seasonal trends to say, we know at a public health level there's more paraflu happening this week, and you are having that same kind of cough I would anticipate. And so that's probably what it is. At the end of the day, I generally say it almost doesn't matter which virus it is, except potentially for flu, if we're talking about trying to get an antiviral treatment for either very young kids, hospitalized kids, kids with high risk conditions, or immunocompromised children. But for the most part, the name of the virus becomes less important than making sure that the child has the supportive care they need and or the testing if we're really considering flu. Yeah, so I think this is a great opportunity again to remind families that we do have vaccines for a lot of respiratory infections, and some of them do require an extra visit. We do know that kids who don't have a well visit in the period around the time we offer flu seasons, but we do know that kids who don't have their well visit scheduled during the period where we offer flu vaccines always have lower rates of flu vaccination just because they're not likely to go to see clinical care. So, sending out reminders, helping families recognize the local pharmacies that might be available, just really encouraging, again, the access around vaccines is great. And the second piece is, recognizing those prevention measures. So, what does it look like to have good hand hygiene, keeping some alcohol-based hand rub in your purse before you go to the birthday party, that kind of thing. But then keeping our kids home and ourselves home when we're sick. So, I think the strangest thing is when, you meet someone and they're coughing like at a work meeting or at a play date, and the parents is like, "Don't worry, I tested for COVID. It's not that." And I think, well, it's something. It's something none of us want. So stay home, right? The name of the virus doesn't matter. The fact that you have a respiratory infection that you can spread to other people with all of this coughing and germs that are on your hands and you're touching everything, that's the thing we want to avoid. So, really good common sense, stay home, keep kids home, and it really helps the whole community do a little bit better during a busy season. Sure. So I think that there's the general list, right? Which is a child has increased work of breathing. They have low oxygen levels when you do a pulse ox in the office. They're becoming dehydrated. You can see that on exam or parent reports. I haven't been able to get them to drink all day. really bad warning signs like altered mental status, meaning they're not answering questions appropriately, they're not waking up right, not urinating normally, more sleepy. We want all those kids to get seen and assessed. And I generally tell folks we would rather more kids get presented to a healthcare provider than need it. It's okay to get seen by a healthcare provider. The healthcare provider says, this child actually looks okay, everything checks out. You can go home. That's actually a lot of our visits. And, we wouldn't want 100% of the kids to be the kids that are sick enough to need to get hospitalized because that would mean we're probably missing some kids. So never feel bad about saying, I'm kind of worried either there's something objective here or just my spiny senses doesn't feel right for this child. For a parent, some of them are very, very familiar, say their child has asthma with, I know what signs of increased work of breathing are. I know what it looks like when their ribs are showing and they're tugging, or their lips are blue, or they're not eating well. I'm very well versed in that. There's other parents who are just, say, I don't know, bring that kid in, see them, look at them, help that parent learn, because it's really, really scary to be at home as the parent and think, I don't know if my child's sick or okay. And we really want to make sure that child's okay. And we'd rather have that sick visit where, again, there's reassurance where the healthcare provider can say, it looks okay, keep doing what you're doing. That's fine. That's still a worthwhile visit, and we want those to happen.